Hi, I'm Brian Lane, Certified Podorthist for Dr. Comfort. Today I would like to discuss assessments, which can be conducted prior to measuring patients for diabetic shoes. I will first review the Medicare DMEPOS quality standards and then conduct an assessment. Now, the DMEPOS quality standards from October 2008, Appendix C, suggests that when fitting for therapeutic shoes and inserts, an assessment is conducted for the following 6 reasons. Number 1, to assess the patient's overall need for the shoes. This would include a comprehensive history, pertinent medical information, which includes allergies to skin condition, diagnosis, which can be found on the patient's prescription, and previous use of shoes. Number 2, to help determine the most appropriate shoes and inserts based on the patient's need to ensure optimum therapeutic benefits and appropriate function as required. Number 3, to formulate a treatment plan consistent with the prescribing physician's order and consult that physician when absolutely necessary. Number 4, to perform a diagnosis-specific clinical examination as related to the patient's need for the footwear. Number 5, to establish goals and expected outcomes of the patient's use of the shoes. Examples of the expected outcomes would include reducing pain, increasing comfort, enhancing dependence, or preventing deformities or promote healing. Number 6, to disclose any potential risks, benefits, and precautions to the physician and the patient. Now, all this is part of the DMEPOS quality standards, and this will help ensure the plan is consistent with the prescribing physician's dispensing order. Now, I would like to perform a clinical examination prior to measuring and fitting of patient's diabetic footwear. And before I perform this assessment, I need to cover a couple things. First of all, I am not a physician. I am not making a diagnosis of any sort on this patient. My main goal is to assess the patient's need for the footwear as it relates to the prescription and provide him or her with the most appropriate shoes and inserts. Second, we are offering many tools you may use performing these assessments. You are not limited to or required to perform each assessment on the patients you see. Think of it as a carpenter becoming familiar with all the tools on his or her tool belt. Each job may not require all tools, but knowledge of each is important. Also, there may be tools that carpenters do not have that they can access if necessary. Finally, document your findings. As an important member of the healthcare team attempting to benefit these at-risk patients, you must document all you do for the benefit of the patient and the rest of the team. If you didn't document it, you didn't do it. Now, these assessments I'm about to conduct should be conducted in a private room, and gloves should always be worn to provide protection for both you and the patient. Now I'd like to conduct the assessment with Amy Kahn, employee of Dr. Comfort here. Amy, thanks for coming in and helping out. Take a seat for me if you would. To conduct this assessment, a couple things. Number 1, this should be conducted in a private room, something where the door can close or a partition so we are away from the other employees or patients of the facility. Number 2, you should wear gloves. Wearing gloves will not only protect you but also protect your patient. And you want to make sure that you are wearing gloves at all times, so I'll be doing this today. The first thing I'd like to have the patient, in this case Amy, do, if you remove your socks and shoes for me please. The assessment should also be conducted on both feet. Not just one foot, but also always both feet. Similar to measuring, you should always measure both feet. So in order to start this assessment, you'll have the patient, or you will roll or cuff their pant legs, just so you're able to view their entire foot, including their ankle. And at this time, you'll start the overall assessment. Now, I'm working off an assessment that is a form that I've developed here. It could actually be found on our website. If you'd like to access that, please go to our website. Now, prior to doing that, of course, as I discussed, you should understand if the patient has any sort of allergies to any sort of materials that we may have as far as the leathers in the shoe or anything that we'll be using, as well as any previous foot or diabetic shoe experience that they had. In this particular case, she was wearing some nice Dr. Comfort socks. However, she did not have Dr. Comfort shoes on. I asked her to do that for me today. These pathetic shoes that she's got on today, we're able to see the wear patterns on the shoes very easily. You can see she's got good gait wear patterns on the shoes. You can see the lateral portion of her heel is slightly worn to her 5th metatarsal head across there and to toe off. So all of that can be seen pretty easily with a shoe like this. If she was wearing some Dr. Comfort, it's not as easy to see those wear patterns. I'd also usually like to remove an insert or orthotic. In this particular case, it is not removable, but that helps us to understand also different wear patterns as well as the length and size of the shoe that she's purchasing. So after doing that, again, understanding her experience, any allergies, then we'll conduct the overall physical examination. The first thing I'd like to start is the biomechanical side of this assessment. Again, part of this assessment also is having the patient do some work as well as you maneuvering the patient's foot. In this particular case, we'll ask the patient to flex their foot. Both put all the weight down there. Very good, Amy, thank you. And then also lift your foot up if you would for me. Again, we're looking for, in this particular case, decreased range of motion. When we have decreased range of motion, that would increase plantar pressure or potentially increase plantar pressure. So we want to make sure that if we notice any of those decreased range of motion, we would indicate that in the patient's chart or in the notes that we have provided. The next thing I'd like to do is the what's called plantar flexion and dorsiflexion, similar to what she did in her ankle joint, but in this case, her great toe or her big toe. So we'll do the same thing here where we do plantar flexion and dorsiflexion, dorsiflexion up and plantar flexion down. Again, good joint mobility in this particular case. The next thing is ankle adduction and abduction. To conduct this assessment, I grab the patient's heel and also her forefoot across her metatarsal heads. In this particular case, we're looking to adduct and abduct. Abduction is away from the midline, adduction is towards the midline. So we look for a limited range of motion. Some of these ranges of motion are somewhat limited, so you will not see a significant movement in these particular cases. Next, we'll do what's called inversion and eversion. In this particular case, looking for that range of motion with inversion and eversion. At this particular point, I would say as far as her biomechanical is concerned, she would actually pass each one of those because she's definitely within the range of the biomechanics, the range of motion on each of those joints. The next one is the dermatological, probably one of the most important assessments you could actually conduct on a patient. In this particular case, you're looking for any sort of wounds, any sort of abnormalities with the patient's foot that, again, you would indicate on the chart or on the patient's notes if you noticed anything. Looking for, of course, any sort of wounds or ulcers, lesions, anything that you see on there, and again, relate it to the prescription. If it's on the prescription, make sure you identify that pretty easily. In this particular case, Amy only has just some mild dry skin on her heel, and this is where I'd probably advise her to maybe get some lotions to do that. The next, I'd look to see how her nails were, if her nails were properly cut. In this particular case, they do look properly cut, nice and straight across rather than curved. If you have them curved, potential for problems such as ingrown toenails. The next thing I'd like to also inspect is between her toes. And I'm looking between her toes to make sure there's no macerations or cuts between her toes because it could possibly lead to some sort of infection. Again, looking all across her foot, no significant abnormalities or any problems with her toes or her feet. Again, no corns that I noticed, just a mild hard spot on the side. Again, not trying to diagnose, just assessing the patient's overall needs. The next is the vascular assessment. Part of the vascular would be, what I use is a non-contact digital thermometer. In this particular case, it's pretty basic to use. You do not even have to touch the patient's skin. It's just a matter of just touching it, pulling the trigger, and we've assessed that she's got a 78.9 plantar surface temperature. We indicate that on the chart, as well as the plantar portion. The dorsum would be 85.6. Again, indicate that on her chart. I would, of course, do both feet in that particular case. Making sure that you're getting some good quantitative results. Medicare does like good quantitative results, and this is a significant assessment tool that you could use. Again, if you do not have that assessment tool, warm to the touch or cool to the touch would be sufficient as well. Obviously, if you have gloves on, you could just feel with your wrist or in some other way as well. The next vascular study I'd like to do is just assessing to see the patient's any sort of digital hair growth. If they've got digital hair growth, that could indicate good circulation. Obviously, loss of digital hair growth is possibly loss of circulation or lack of circulation within the foot. So observe that. It looks like she has shaved both her legs and her toes recently, so obviously she had digital hair growth at one time. Next thing, you want to look for overall color. You want to see if the color is actually a normal color. It matches, obviously, the color of her leg as well. And indicates skin color if it's out of the ordinary, any blues or purples or anything. Next test is a pretty easy test to do. An assessment is called Capillary Refill test. In order to conduct this assessment, you apply 2 to 3 seconds of pressure and let go for 2 to 3 seconds. Within that time frame, within 2 to 3 seconds, the color should refill back into the patient's toe or wherever you decide to do that. I recommend the great toe on the top. That usually is a good place to do that. So I would indicate again the number of seconds or the length of time it took to refill those capillaries. The next one is texture. Overall texture of the patient's foot, if there's anything that, if it's fragile, thin, shiny, a lot of those, again, indications of maybe severe edema or other issues. And finally, you want to conduct you want to check the pulse. There are 2 pulses that you could actually check on a patient's foot. One is called the posterior tibial pulse. That is found behind the ankle bone called the medial malleolus, right through here, and between that and your Achilles tendon right here. To conduct this, again, we're not going to check our watch to see how many beats per minute. We're just checking for presence or absence. In this particular case, I reach right around and I could feel a pulse, so I'd indicate that as present. Okay? It's a mild amount of pressure right into the medial malleolus. The second assessment, the second palpation, can actually be found between the first and second digit, about halfway up the foot. You apply a mild amount of pressure across there. And again, I feel a pulse, so we're going to put present. Again, at this particular time, you're not diagnosing. We're not saying that she's got peripheral vascular disease if we cannot find a pulse. We're just assessing to make sure that we understand that this patient just has poor circulation if we cannot find a pulse. And the final 2 tests that we could actually conduct, one will be with called Vibratory Sensation with a 128 hertz vibratory tuning fork. In this particular case, I usually demonstrate on the patient's hand. So what you do is make sure it's vibrating, and then I just demonstrate on the hand. When you feel that vibration stop, I want you to let me know. Okay? So we do that for the patient. So the place I conduct this is actually just proximal to the great toe in that joint right there, and the tuning fork will vibrate for about 20 seconds or so. Don't tell the patient that, but it'll vibrate. When it stops vibrating, the patient told me it stopped. I'm going to count in my head 4, 5, 6, 7, 8, and now it's stopped. And she actually passes that test. The way she would fail is A, Amy would not feel that at all, or B, she felt it stop right away and it continued to vibrate beyond that 8 to 10 seconds. Okay, so that was a pass on the vibratory sensation. And the last neurologic test would be a Semmes Weinstein monofilament. It's 5.07, 10 grams of force that I'll be applying on the bottom of her foot as well as the top of her foot. Again, demonstrate on the patient's hand. Amy, every time you feel that, I'd like you to tell me yes. Okay, so again, same thing here. If you'd close your eyes, we're going to try several different areas on the bottom as well as the top of her foot. Every time I apply that pressure, the Semmes Weinstein monofilament actually has to curl or bow up in order to apply that 10 grams of force. So every time you feel it, please say yes.
Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes. Yes.
Okay, so for every time that she said yes, which actually happened to be every single time, I would indicate on my checklist here, I've indicated a plus sign saying she has felt it, and a minus sign if she actually did not feel that Semmes Weinstein monofilament. Again, that was 10 grams of force in that particular case. Now, these are some of the many tools that you can use. There are definitely other tools that you can choose to use in order to conduct assessments. Anything that would capture or otherwise get quantitative results for a patient and for Medicare for that matter would be definitely beneficial. I have a couple other ones. One could be a digital camera that takes a great image of the patient's foot. Another one is called a Harrismat or pedograph. In this particular case, some ink has been rolled on one side of this foot imprinter. We're going to have the patient walk right across this, and that's actually going to leave an imprint of the patient's foot. In this case, it's Amy's, so she's going to walk right across that. Thank you, Amy. And I'll lift that up, and you'll see once we remove that, it leaves an impression of the patient's foot. In this case, we see a little bit darker area on her great toe as well as about her 4th and 5th metatarsals. In this particular case, obviously, any increased pressure is going to be a darker area. That's a nice assessment tool, not only for you, for your charts, but also for the patient to take home. I usually recommend to make a copy. There's another assessment tool that's a little bit better, in my opinion, than a pedograph, and this is called the pressure stat. The pressure stat is a little bit better tool to use because it takes a nice even flow, a nice even impression of the patient's foot in this particular case as well. very easy to use. So any of these assessment tools can be used with you and your patients in your facility. Again, if you choose to use these, again, please don't hesitate to contact us if you have any questions about how to use these devices or where to get these devices. We will have most of that information on our website. Please don't hesitate, again, to call any one of the several podorthists that are on staff here at Dr. Comfort. We thank you for watching this assessment and hope it helps. Thank you.